Hello, welcome to Government Connection. My name is Vicki Evans. Every day, the 24-hour emergency hotline at the Arizona Poison, Drug, and Information Center answers about 200 calls. That's 200 calls every day. And half of those calls involve children under the age of 5. And without the experts manning the hotline phones, nearly 70% of those people would have had to go to the emergency room, and that's a costly expenditure. So we're going to learn much more about this valuable service that's not only available to us in our area, but also in southern Arizona. As we welcome Jude McNally. Jude, thank you for being here.
Well, thanks for having us.
You
it's
bet.
A pleasure to be here.
Good. I'm glad. And Jude is the managing director of the Poison Control Center. And then we welcome Liz Barta. Liz,
Hi.
Again, thank you for being here.
Oh, yes, I love being here.
And Liz is a poison education prevention specialist with the Arizona Poison and Drug Information Center, better known as Poison Control, right? Poison Control Center. Jude, I've just given a thumbnail sketch here. So talk about basic services.
Well, basically, the Poison Center is the place that you call 24/7, where you can speak to a pharmacist who has special training in toxicology and certified as a poison specialist to help you figure out if your situation is a potential problem. Or especially in the case with Liz, we'd want you to call before you actually even have a poison emergency, and it may be something that we can prevent by providing some information. So we try to think of ourselves first and foremost as an emergency service, but then secondarily as an information source that may prevent emergencies as well.
A lot of education going on at the that you also provide to the community.
Absolutely, and I mean that's really where Liz comes in.
Right. Well, I'm out there doing fairs, presentations, creating programs, doing trainings with all kinds of healthcare providers or school teachers, whoever wants to learn how to prevent poisoning, because it's such a big injury source in our state and also throughout the country. It's one of the leading causes of injury, unintentional injury in the country.
All right. And you know, when you said there are pharmacists, people have been trained,
Yes.
what do you call them? Poison
We call them poison specialists.
Tell me what goes into, what do you learn to become a poison specialist?
Well, we start out with a pharmacist, and I know for some people that's not going to be real intuitive, why a pharmacist would do this job. But a pharmacist's job is actually to understand what happens when a drug, which is really a chemical, enters the body. Where does it go and what does it do? You want to know the beneficial effects, but it's real important that you know the adverse effects. Well, a toxicologist studies a drug or a chemical that goes in the body, and where does it go and what does it do? It's really the same science behind these two disciplines. But as toxicologists, we're kind of focused on just the adverse effects. We're not looking for a beneficial effect here. But really, the tools that we have to treat patients and the science that we have to predict what will be a problem and what won't be a problem are identical to those tools we learn in pharmacy school. But of course, a pharmacist doesn't necessarily learn what's in Windex or Ajax when they're in pharmacy school. So about 2 years after graduating from a college of pharmacy, you can begin a training program that will last about 2 years in a poison control center, at which time you've handled enough cases, you've had enough experience that you're eligible to sit for a national exam. That exam is offered once a year, and 100% of our eligible specialists have passed that exam, and they're called officially Poison Information Specialists.
All right, okay. That's a lot of schooling, because a pharmacist I know goes, gosh, how long is a pharmacist?
If you're real clever, you could do it in 6 years, but we find that many of our pharmacists today get undergraduate degrees before they enter a 4-year doctorate of pharmacy program at the University of Arizona.
All right.
And I also want to add that these people are really special because they actually care about what they're doing with their jobs. When people in the public learn when I'm giving my presentations that it's not volunteers, and they say, well, yes, I've called there and they're experts, they also talk about how caring they were and how much time they took with them to really explain and reassure them.
So not only the knowledge, but a great bedside manner,
Yes,
because everybody's
definitely.
scared. I imagine when they call the hotline, they're scared. How did the Poison Center get started? And we have a new governor as of today, and legislature. What's happening in the legislature?
Wow. I'm so happy to talk about your first question, and I'll get quite sad to talk about the latter. But our Poison Center has over a 50-year history within the College of Pharmacy. Really started in Chicago when a pediatrician walked up to a pharmacist and said, seeing all of these kids getting into household cleaning products, that they had an explosion of products in the home, better living through chemistry philosophy, and they just didn't know what to do. They didn't know what was in them. Labeling was not as sophisticated as it is today. And this pharmacist agreed to try to help the pediatrician when these kids came in so sick. Our College of Pharmacy became aware of this and began that same program here in Tucson. Al Piccioni, then a young professor in the College of Pharmacy, in 1955 began offering his services to local pediatricians when they had this kind of problem, something that he could investigate, and through his training he could help figure out what's going to be a problem and what can we do about that. Well, eventually that program kind of grew, and it required the entire faculty of the College of Pharmacy to take turns being on call, and of course eventually they invented beepers, and that helped a little, and then finally, but in 1980, the state had recognized the value of this service to such an extent that legislators decided to fund a program. And when they did, naturally, they gave that money to the College of Pharmacy, who for over 25 years had already been providing that service. And that's when they first hired real-life pharmacists who would work 24/7.
So for 25 years, it's been funded by the legislature.
28 years.
Can you even have a guesstimate at how many people?
Oh.
Well, do you know monthly or even a monthly total?
Yeah,
We're
we
talking
do 70,000 calls a year.
70,000 a year times 25, at least, right?
This late in the day, I'm not going to hazard a math guess, but you know, we feel like millions of people have been served in one way or another through the Poison Center.
Right. So what is up with the legislature now? What are some big concerns?
Yeah, we just learned this week that the Joint Legislative Budget Committee, those people responsible for proposing our upcoming budgets, have chosen an option to eliminate funding to our Poison Control Center. After 28 years in this form and all of those people served, they have proposed that they'll not fund the program and instead privatize this service with a hospital in Phoenix to provide statewide services. But we're afraid that this might be very short-sighted, that while I did describe to you the bare essence of what a Poison Center is by being a 24-hour emergency service, it's so much more than that. And there's so many more services that would be lost in the move that they're proposing.
Right. We have a math whiz that we just keep on staff to answer the question that I asked, and about 2 million people. Yeah. 2 million people. So is this there's a blog site that's been created, right, that people can go and see how they can talk to their legislators about this proposed elimination of the Arizona Poison and Drug Information Center. And this is it. We've pulled it up. Take a look here. And that's it on the bottom, the actual website. It's
I'm glad you put it there because we haven't even got it totally memorized yet. It's so new. So I'm inviting your viewers to be some of the first people to blog on and find information about how to contact their legislator, and it'll even show you who your legislator is by your address. So everything's there for you to help support the Poison Center and to find out more about what's going on with the Poison Center.
All right. And that website is aspicinfo.blogspot.com. Again, that's aspicinfo.blogspot.com. And go ahead.
I would like to point out ASPC and where that came from, but it's actually sort of the renewal of something from 1993. ASPC was a group of private citizens that when they heard our funding was jeopardized in 1993, formed what they called the Alliance to Save the Poison Information Center. And fortunately, they were effective. We lived to fight another day and to continue to provide the services. And upon learning this week, some of these people resurfaced and said, we're going to do something different.
Great.
So this blog site that we're talking about is actually a private citizen effort to try to keep the services here in southeastern Arizona and to try to keep the level of services that people have come to expect from us.
Let's talk about who does the Poison Center serve? Hospitals, you mentioned pediatricians, you know, that was how the whole thing got started years ago. So who do you serve?
You name it, they're served. I mean, definitely the public, anybody at home, moms, dads, the elderly, everybody that could have any exposure to something in their household or through medications, through gases, and in this state, injectable, which we call venomous creatures. So bites and stings, that's a large amount of our calls, especially in the summer months. Yeah. So those people, but also the Poison Center is our consultants for doctors, nurses, clinicians, anyone around the state, outside of Maricopa County, of course, that needs to have a professional and an expert in toxicology and pharmacology.
So it's out Maricopa, where Phoenix is,
right?
Our big sister to the north. Every other county is your serving.
Yeah, we're the donut, and they're the center of the donut.
Oh my gosh, all right. Well, we do have a caller. Lisa, thanks so much for calling. What's your question?
Hi. Well, I just heard the part about how the legislature is threatening to cut your funding, and I take it that means entirely, which would shut down the Poison Center, which I find really appalling. And the question is, could 911, you know, the 911 emergency call do what you do? And if not, maybe the legislature needs to really get that. Okay,
all right, thank you. Good point. So can 911 do what you do?
Thank you.
Okay, thank you. Bye-bye.
Thank you very much for the support and the kind words. And, well, 911 is a fabulous service. 911 can't replace a poison control center in that their job is, in fact, something entirely different. 911 is there to help you get to a poison center or to get whatever level of care you need. In an automobile accident, they're there to try to get you to the hospital. In a fire, they're there to try to get the firemen to your home. In the case of a poisoning, they're there to try to get you to the poison center. Unfortunately, when we say 911, it's a very complex system statewide. And there's not one office that's serving Chinle and Safford and Sierra Vista and Yuma. In fact, there's many 911s with many different levels of service. And while they're very professional at what they do and they provide life-saving services, they don't require them to have the 6 years of pharmacology training that our specialists have, the 2 additional years of toxicology that we can help make these decisions immediately.
So if a person calls, my little one swallowed Ajax, and I'm not sure, you know, or Windex, excuse me, swallowed blue Windex thinking it was Kool-Aid. So if I call 911, they're basically going to put me in touch with you. Is that correct?
We would hope that they would.
That's kind of the way it works, right?
Vicki, sometimes that system breaks down, and at the risk of wasting too much time on a story, I did have a situation where a 14-month-old child got into a plant called a Scheffalera, and Mom was very upset, and the first time the child had really gotten into anything, she called 911. They immediately dispatched an ambulance. The ambulance went out, tried to get the child to UMC, but they were on divert because they were so busy, got the child into TMC, and there they had to wait. And after a couple hours of waiting that I'm sure felt like an eternity to the mom, they finally raised such a ruckus that the physician called us and said, "Can you tell me about a Scheffalera?" We're able to say that was completely non-toxic. That's kind of an example of what happens when the system breaks down.
Right.
911 could have given us that call, and we could have reassured Mom and followed up with Mom to make sure that there were no problems. The paramedics could have called the Poison Control Center, which they quite often do, and avoided a transport. The first receiving hospital could have called, or the second receiving. At any given point along the way that the Poison Center would have been involved, we would have saved our community health resources and saved money in the process.
Right. Well, actually, when I introduced you, the statistic I found was 70% of the people who call, you help them avoid that costly, fee or that costly trip to the emergency room or an ambulance, the price of an ambulance. And we do have a number. This is one you should write down. Keep this one by night, or contact Liz. I'm sure she's got stickers. And it is the Arizona Poison and Drug Information Center, and this is the hotline, right?
That is correct.
And this is a national toll-free number, by the way. And when someone calls, their area code is registered in the computer, and it will know which poison center to route that call. So this number is good anywhere in the country.
Oh.
So it's not just for our center, it's anywhere. So get this number, and also if you go to our blog, you'll get the website, and you can contact me through the website and get these stickers and magnets while they're still available from our center. Because the caller's question, yes, if the proposed legislation goes through, we would close our doors. It's not a reduction in our service, it is removing our service.
Right, right. And I just want to say the number out loud for you while you're searching for the pencil here. 1-800-222-1222. That's 1-800-222-1222. And we might as well put the blog, if we can have that blog as soon as you're able. We'll remind people about how to contact the legislators, the Arizona legislators, about preserving the Poison Control Center. We've talked about filaria, the plant, right? I'm trying to remember.
How about Schefflera?
Schefflera. And some lookalikes. I talked about the Windex, the kids.
Right.
But let's talk about some other way people are poisoned. And I know we've got a couple of illustrations here, so maybe we could begin to bring those on for us, and Liz and Jude can talk about them. Things like a bucket full, your cleaning bucket full of supplies.
Right. Household cleaners are one of the leading causes of poisonings, because most of the poisonings do occur in the home. At least 70% of them do. And so many times people aren't aware that when they're in use is when they're going to be poisoned, or when someone will get into them. Because if you use the mop and glow or whatever it is, you set it down, and the little person comes up, or someone that wasn't paying attention, doesn't have their glasses on, doesn't have the lights on, is in a hurry, is stressed, which none of us really ever are, and they pick it up and take a big wallop, or they splash it in their eyes, whatever. It is in cabinets.
It's not just about swallowing. That's a good point.
Right.
It's burning, it's eyes,
it's fumes. And also, like we talked about, injectable things from bites and stings, mostly in this state.
How many of those calls, the children under 5, involve the next item, and that's drugs that can look like candy?
That's a big one. In fact, actually, nowadays we would say medications, right, are ahead of household products in terms of unintentional poisonings.
So are these kind of a gummy candy, Liz? And what's the one that's not good for you?
Well, that's the whole point. Which one is the candy and which one is the vitamin, possibly even with some iron in it? I'm not going to tell you which, because it doesn't matter. What matters is that children and adults as well, whether it's something geared towards a kid or an adult, should always keep things in the original containers and should always be supervised, so that people are aware of what's on the label and read it appropriately before they take it.
And again, this is candy and medication, right?
Yes, definitely. Well, this one you can tell which one's the M&M.
Yeah, and
right.
But if you turn the pill over, we might,
Or if you can't read, or like I said, you don't have glasses on, don't have your lights on. Anybody get up in the middle of the night because they're not feeling well and go in the medicine cabinet and think they're taking something that then they realize after they turn the light on, oh, it wasn't that. Wouldn't you like to have a poison center to call to say, what do I do now?
And something like this, just to...
That can be a cough syrup, but also there's tick and flea killers that people keep in their medicine cabinets that look very similar. And the kids say, this tastes really bad. That's okay, it's good for you. And then they take it, and then the person looks at the label later and realizes, what have I done? I've given my kids something that could kill them, maybe, I don't know. And within 30 seconds, many times, they can get reassured that it's all right, or what to do.
And then along, we mentioned just injectables, is it you call it? But that's what kind of makes this center, the Arizona Poison and Drug Center, unique.
Right.
So,
Well, it is true that over half of our calls are kids under the age of 5 who got into some household cleaning product or medication. But that's true across the country. All poison centers are pretty much experiencing that same thing. What's unique about Arizona, and especially our Southeastern Arizona Poison Center, is that we handle more bites and stings per capita than any other poison center in the country.
more than Florida even, huh?
Yeah, 20% of our call volume involves some kind of bite or sting, and that amounts to like 2,700 scorpion stings a year, 500 black widow bites, hundreds of snake bites that we're called about, and that we've had the opportunity, because of where we live and where we practice, to develop.
Here's our black widow friend.
That's our friend. That we've had this opportunity to develop an expertise that, say, if we were a poison center in Vermont, they might never. And that opportunity has been turned into research opportunities and leading research for how to treat these across the country.
Who are we looking at here?
This is our Arizona brown spider, sometimes mistakenly referred to as a brown recluse spider. It is in the same family as a brown recluse, but this is Loxosceles arizonica. And
Oh, he's good.
That's why you need a pharmacist.
and he's a little bit sneaky, because many times we won't even feel the bite from this guy, and it will be hours and sometimes even days later that we have a sore developing at the site. That sore can eventually lead to dead tissue at the site, and the
So he is as deadly as his brown recluse cousin?
Well, yes,
Or
he
acts
is.
upon the body
he
the same
actually
way,
can
right?
be. Yeah, the toxin that he has is in essence the same thing, which is destroying tissue right at the site, and in some really bad envenomations, also breaking down our blood cells at the same time. And the worst part is that that lesion can go on for weeks, and in some cases for months, and may even require that a patient have some reconstructive or cosmetic type surgery.
Wow, wow. So go a little more into depth about how this has led into some research and what that research is.
Well, as I said, if you've got the critters, you got the patients, and if you got the patients, we always want to find better ways to treat them. Poison Center that's based in an academic institution just can't help but want to find other grant sources. We do not use our emergency funds appropriated by the state for the research I'm about to describe. These are all separately funded activities through grants, FDA grants, orphan drug grants, drug companies that would like us to explore new products for them. Our greatest success in the last 3 years has been the distribution of a scorpion antivenom. We happen to live in the only state in the country that has this life-threatening bark scorpion. And while most of our healthy adults are going to call the Poison Center after they're stung, be given first aid, and be able to stay at home with this, children, and especially children under the age of 5, can have a life-threatening response to the bark scorpion. And 7 years ago, the antivenom that we had to treat that went out of production, and we had to look for new ways to treat this.
Oh my gosh.
And over the last 3 years, I can tell you that we have successfully, by incorporating 22 different hospitals all across the state, teaching them how to use this product and how to become part of an FDA study, and treating and teaching over 200 clinicians, that's physicians and nurses, about what it is we need to collect, what data the FDA needs to eventually approve this drug. We've successfully treated over 650 patients.
Wow.
And what this has meant for us is that 95% of these kids who used to get admitted to the ICU, who used to spend 24 hours, and many of them, up to 15%, requiring some respiratory support to literally be put on a ventilator in a life-threatening situation, these kids are leaving the emergency room 2 hours after they receive the injection.
Wow. And all that'll go away if this proposed legislation goes
This
through.
program will be done. This program will be gone. And this is something where we say we serve the entire state except Maricopa County, but we serve Maricopa County with this study. We have hospitals enrolled in our study, and we provide that drug for them there as well. So there's many ways. That's just one example. We have a pregnancy risk line which is in essence a kind of specialty in toxicology that looks at drugs or chemicals that you might be exposed to when you're having a baby, and how are those going to affect that
So just a
developing
lot of
fetus?
research going on.
Yes.
Right.
Really, really necessary research. And I just want, and I'm interrupting, and I hate to, but I want to make sure that in 2 weeks, please tune in, because it's old rodeo time in the Pueblo here, and we'll be talking to the Tucson Rodeo Parade, members of that committee who put the parade on. I think this is, golly, I'll regret saying it, I think it's the 86th or 7th Tucson Rodeo Parade, and if you've never been to one, it's definitely a Tucson tradition. So next week, or 2 weeks from now, February 4th, tune in to Government Connection, 6 p.m., and we'll talk about the rodeo, which is kind of a segue back to really a happy time there. My segue is the work you do prevents such tragedies and allows people to continue with their lives, you know?
It is very rewarding in that respect.
Yeah.
And we're also feel so fortunate to be as a university-based program in a situation to call upon experts that otherwise you just wouldn't have gathered together. We have mycologists who spend their whole life studying mushrooms, and entomologists who study bugs, and we have agricultural specialists who study pesticides. And after years of dedicating their life to that, we can go to them and call them at 2 in the morning and say, we have a child in Yuma. How can you help us?
Right. And we're running out of time, and I want to make sure you get that Blogspot address up one more time. And if we could just even, it's, remember, ASPIC info, ASPIC info.blogspot.com. And again, just in 30 seconds, tell us why it's so important that people support that they need, what they need to do to support the maintenance of the Poison Control Center.
I think what we need to do is express to our legislators that this is not an expensive program, this is a cost-saving program, and then as soon as we absolve this and lose some of the services that our center's been able to provide, we'll see costs soar in other healthcare areas. That this is cost-saving and life-saving, and we need to convince our legislators of that.
Thank you both, Jude and Liz. Thank you both so much. Saving our lives, and now we can help them. The Arizona Poison Control Center. Thanks. Thanks, guys.